Hey, this is Doug Field along with my co-host Ron Bachman, and welcome to the final segment of Healthcare Consumerism Radio. Joining us today is a friend of the Institute and a member of our League of Leaders, John Kaegi, Chief Strategist with Healthstat. Good morning, John.
Good morning. How are you doing?
Doing great. Hey, look forward to seeing you real soon, maybe here.
Yeah, it seems like yesterday we were together at the last IHC conference, and I'm looking forward to another one.
Yeah, you got it. Hey, nice to have you here. To the audience that doesn't know Healthstat, give them take a minute or so and give us a picture of Healthstat and your position in this space.
Sure. Healthstat is, we believe, the leading provider of on-site health care services and wellness services for employers across the country. We were founded originally in 1994, changed our name and incorporated in 2001, and today have over 330 Healthstat clinics representing 125 clients in 32 states across the country.
Yeah, and your niche is that worksite and promoting worksite health promotion. And then what's some of your current strategies that you're helping your clients execute?
Well, first of all, our clients are very concerned about the obvious costs of their health benefits. And so our original strategy was to defer some of those costs by having a lower cost but high-quality solution on site for them that provides them with hard dollar savings against their health benefit costs when they have less time away from work and they're visiting more cost-efficient providers. But now, in the last several years, and I agree with the previous interviews, wellness is always on, and our clinics are very committed to and passionate about health promotion, discovering health risks and treating those health risks, and getting people to become more health conscious and to have healthier lifestyles, which improves productivity quite a bit. So that's really what we're trying to do. Now, to do that, we've recently announced a partnership with ProChange Behavior Systems, which was founded by Dr. James Prochaska, the creator of the trans-theoretical model of health behavior change. And so that particular partnership is going to help us to maximize the highest possible level of health engagement as well as health outcomes and lower costs and improve productivity for our employer clients.
Hey, John, this is Ron Bachman. You know, the on-site concepts has really been booming across a large part of the country. Can you tell our audience a little bit more about the size of the employer that you're working with? Is it rural areas, urban areas? Is it multiple employers can get together to access this? Tell us a little bit more about what your market is.
Sure. Healthstat is a national company serving, as I said, over 125 employers in 32 states, and there's really no one magic formula for it. We have rural areas, we have metropolitan areas, we have large employers with over 20,000 employees, we have small employers with 250 to 300 employees. So we customize our sites for the needs of the employer, and we go down to really as low as 250, 300 employees in one location. We're also offering now a shared clinic approach for even smaller employers to work together, and this is really attractive to small employers who really can't self-insure yet. So they're looking for productivity improvements and to provide a strong health benefit that may help backfill some of the decisions they've had to make up in the health benefits area due to the Patient Protection and Affordable Care Act. And so we can put together a shared clinic near site to several employers that all get together and share the clinic. So really the size of the employer isn't really a factor. We've got a solution for any size employer.
Well, when you say on-site wellness, just again, so the audience is clear of what your services, are you putting people actually on site? Is it the focus is the workplace for your products and services? Is it a brick and mortar? Is it a dedicated spot location at the employer's workplace?
Often it is a dedicated spot at the workplace, but our services go beyond just the workplace environment. We provide what we call population-based health risk management. So our clinicians and coaches get involved with employees anywhere they live, even outside of the area of the clinic, to work with them telephonically, electronically, to help in conjunction with the employer's programs for incentives and so forth, to help them to have the healthiest possible lifestyle. Now, on-site, we provide not only the wellness services, but of course the standard urgent care kinds of services as well, where we treat colds and the flu and things like that as well. But about 70% of our effort is proactively engaged in trying to reduce the health risks of employees.
Now, come back, John, and talk a little bit more about your recent relationship with ProChange Behavior and what you're doing there.
Sure. So ProChange is the leading company in the country devising ways to help employers improve the health of their employees. So ProChange is based on a trans-theoretical model. And we know that about 80% of Americans are really not prepared to change their risky health behaviors. And the trans-theoretical model describes the steps that people go through in order to make those kinds of changes. So by joining forces, we are combining our nationally recognized health delivery model with ProChange's evidence-based health behavior algorithms, and we're embedding those into our systems and workflow. So we are training our clinicians. They will all be finished with their training the end of this month. And we are adding the ProChange's logic into our health risk assessment to help us determine the patient's readiness to change. It's not enough to know if a patient has a risk. It's also critical to know the patient's readiness to change. What stage of the trans-theoretical model are they in? And then that way we can customize the program and the advice and counsel and tools that we give to those patients to help them move from one stage to the next. On top of that, we're putting all of this logic into our electronic medical record, and that will not only provide us with the information we need on each patient, but also it actively prompts the clinicians to interact with and coach the patients based on their readiness to change, and it provides customized, tailored messaging to support those patients in a variety of ways: emails, patient portals, text messages, and so forth. So that whole ProChange model is now being integrated into our Healthstat systems.
This is very unique value proposition from Healthstat, correct?
Well, it's the only one of its kind. We have an exclusive arrangement with them for this relationship to integrate this data and information into our systems.
John, that's a big, fancy academic term, trans-theoretical model. Can you bring it down to earth for our audience and what that really means? And is that a process for your providers to follow, or is it a process for the patient to follow, or some combination thereof?
Well, Dr. Prochaska is famous for saying that behavioral change, health behavioral change, is not an event; it's a process. And when you look, what he discovered was the 5 stages that that process entails. It begins with what's called pre-contemplative level, meaning that the people who are pre-contemplative about changing health risk behaviors really are not confident that they could make change. They're not planning to change at any point in time, and probably don't even believe that change is possible. The next stage, though, is contemplative. So if we can get someone from pre-contemplative to contemplative through coaching and through developing a strong personal bond with them, then the contemplative level is now they agree that they could change. They would like to start thinking about how they might change and how they might do it. And then the next level is to prepare for that change, preparation. And that means that I have made a commitment to start this change within the next 6 months. And these are the things I'm going to be doing, and of course then we can help reinforce that and get them to get started on the process. And then they get into the action stage where they're actually working on those changes they need to make and improve their health behaviors. And finally we get into the maintenance stage, which means that they've really incorporated that lifestyle into their lives, and now they're just maintaining that lifestyle. As we know, about 80% of Americans are in the contemplative or pre-contemplative stage, which is bad news. The good news is that the ProChange model we know from the ProChange model that we can have effect on most people, and we can move many people out of that contemplative or pre-contemplative stage into action.
So as people are going through this, what results have you seen? Has the ProChange been applied? I mean, it's sort of a generic approach to any kind of a change. Now you're applying it to healthcare. Has it been applied to healthcare before, the relationship with ProChange, or is this unique for bringing this into your company?
Well, this is unique, and it's just starting now with our company. Mm-hmm. But ProChange behavior systems have been around for a number of years, and they have many studies that show the effectiveness of their work, showing anywhere from 30 to 50% improvement in the health and behavioral risks of the people that they work with. So without the approach of ProChange, health on-site clinics can have some effect and will certainly lower costs and provide a positive ROI for the employer. But with the ProChange, you can multiply that by 30 to 50% higher in terms of the benefits that the employer will reap from this relationship.
John, we got time flies when we're having fun, and this is a great discussion. I appreciate you being here. We've got about 30 to 45 seconds to go, and I want to give you a chance to leave our audience with a couple takeaways.
Well, sure. One of the things is that there's a lot of talk today about wellness doesn't work because we see critics that measure one item of wellness. And certainly wellness programs are more talk than walk if all they do is measure and inform. Mm-hmm. Research shows that information and education alone are not sufficient to change healthy risk behaviors. And it really requires a commitment by both the employer and their partner to take it beyond just information and measurement into active work with those patients to help them change their health behaviors. So to do so will maximize health promotion for the employer and their employees, and that will take them to the highest possible level of return.
John, listen, we appreciate it. Look forward to seeing you in May at IHC Forum, and to our audience, you can join John in May 7th through 9th at the IHC Forum. You have a great weekend, John. To our audience, you have a great weekend as well, and we'll see you next week on Healthcare Consumerism Radio.
Thank you, Doug and Ron.